Now I am going to discuss about the palpation of medial ankle. So again it is start with the palpation of or localization of medial malleolus. So here it is already marked. This is the anterior margin, this is the posterior margin, and this is inferior. So this is the complete location of medial malleolus. How to identify? First, you have to place your hand flat over here, identify the bony prominence, then mark the all the margin of the medial malleolus. So I just identify complete margin of the medial malleolus and it marked. Basically, it is used for localization. Every landmark related to the medial malleolus is very important and it is taken as a reference point. So, first start with the anterior margin. As you can see here, I have marked the anterior tip of the medial malleolus. So, basically it is used for identification of with identification of the anterior tip of the medial malleolus. Basically we can identify the next landmark, that is your head of the talus. So, first of all, place your finger pad just anterior to the anterior margin of the medial malleolus, slide it little bit more anteriorly, apply firm pressure and then perform rhythmical plantar and dorsiflexion of the ankle. While performing the plantar and dorsiflexion, you have to appreciate the movement or try to identify the bony hardness just anterior to the anterior margin of the medial malleolus. So, while performing this, basically while performing the dorsiflexion, the bony hardness which is found just anterior to the anterior margin of the medial malleolus, that will disappear. When you perform the plantar flexion, it is again reappearing. So, basically it is the head of the talus. Same way, we can identify the posterior margin of the medial malleolus and then slide your thumb pad more posteriorly, apply firm pressure and perform the same movement passively, dorsiflexion and plantar flexion, and try to identify the bony hardness. With firm grip, you can palpate the bony hardness over here, and when you perform plantar flexion, it is going in or the bony consistency will disappear. When you perform the dorsiflexion, it is reappearing. So, basically this is the location of the body of the talus. Okay. Now come to the next reference point, which is your inferior margin of the medial malleolus. So, with the help of identification of this inferior margin, we can identify the multiple bony as well as the soft tissue landmark. So, first we can identify the location of your medial collateral ligament, as I marked with this black spot. Basically it is the location of the medial collateral ligament. So, for identification, just place your thumb pad little bit more inferior to the medial margin of the medial malleolus and then perform a transverse palpatory technique. Concentrate your force more over the tip of the thumb or finger pad and then perform this movement and try to identify the elastic consistency over here. We can identify two different consistency. Basically, this is the location from where the tendon of tibialis posterior also passes. So, you have to appreciate or you have to differentiate between these two landmarks. So, calcaneum ligament is little bit thinner as compared to the tibialis posterior. So, you have to differentiate between these two landmarks and focus on the thinner one. If you are not able to identify it properly, then apply passive eversion of the foot and then again perform the same movement. Basically, this eversion lead to the tensile stress or the medial collateral ligament, and you will be able to identify it very easily. So, this is the location. I can identify it very easily. The next landmark, which is found about 1 centimeter in most of the subject from the inferior tip of the medial malleolus, that is Sustentaculum Tali. So, here slide your thumb pad little bit more inferiorly and perform circular palpatory technique and identify a small bony elevation which is formed because of the Sustentaculum Tali, and it's again is provide the attachment to the medial spring ligament. Next landmark is your navicular tuberosity, which is marked here. So, we have two different methods to identify it. First, you just have to slide your finger pad from the Sustentaculum Tali to the more anteriorly, slide it more anteriorly, and it is a large bony prominence. Perform circular palpatory technique and you can identify it over here. So, basically this is the location of your navicular tuberosity. The second method is you can identify it with the help of the tendon of tibialis posterior. So, again make a grip like this, instruct the subject to perform inversion. Yes, and you have to identify a strong tendon which is found just inferior to the inferior tip of the medial malleolus. So, I can identify it. See the movement of the finger, it is coming out, it is going in. Because of the presence of this tendon, the finger is coming out. So, just follow this tendon and ultimately you will reach over the navicular tuberosity. Next landmark is the location of your rest of the two more important tendon. One is your Flexor Digitorum longus and second is your Flexor hallucis longus. So, basically these, to identify these tendon, you have to slide your thumb pad or finger pad more proximally from the medial malleolus, because in this subject it is I can feel it, these tendon just posterior to the medial malleolus or in lower location or lower position, but in most of the subject in pathological condition this area will remain filled with swelling or other means in obesity it is remain filled with the adipose tissue and it is very difficult to identify it here. So, for identification of these two tendon you have to, it is convenient to shift your finger pad more proximally. You may follow the tendon of tibialis posterior, slide it again posteriorly toward the tendoachilles and then ask the subject to perform the toes movement. You have to keep the big toe free and you have to apply the pressure against the rest of the forefinger and ask the subject to perform rhythmical plantar flexion, relax, press, and try to appreciate the contraction of flexor digitorum longus. So, by doing this, you can identify the next tendon, that is the tendon of flexor digitorum longus. Again, leave this tendon and slide your thumb pad more posteriorly toward the tendoachilles, and that tendon will be your flexor hallucis longus, and this is found just anterior to the tendoachilles. So, again position your thumb pad or finger pad over here and ask the subject to perform the big toe flexion, relax, again, yes, relax, and you have to appreciate the contraction of flexor hallucis longus. The next structure that we can identify around the ankle is two more structure is still there, that is your tibial artery and nerve. So, basically it is found just posterior to the body of talus. So, you may shift your thumb pad little bit more proximally, because this is the location where the flexor retinaculum is found or tarsal tunnel is made, and these two structure passes just posterior to this. So, for that purpose you have to shift your thumb pad little bit more proximally, and first we can identify the body of talus. Position your thumb pad little bit more posteriorly, shift it proximally and apply gentle pressure and appreciate the knocking of the tibial artery. So, I can feel it over here, and at the same location the tibial nerve is also passes. For that purpose you have to apply pressure against the body of the talus, and if you are maintaining this pressure for a short period of time and ask the subject for any abnormal sensation in the foot. If it is appearing, then your location is right. So, it is all about the palpation of the medial side of the ankle.